Hi, everybody. Hi. Welcome back to session 10. I'm Karen Levy, and I'm happy to welcome you to our session on empirical studies. I think empirical studies are one of the most promising avenues for the interdisciplinary work that the FATSTAR community has been working so hard to include. I also think it's a great place to really find the life and the blood in the topics that we've been talking about in a really real way that kind of does justice to the people who are heavily impacted by the decisions that we're concerned with. So I'm super excited about this session, and 2 of the 3 prize-winning papers are in this session. So congratulations to the first 2 papers, both of which are winners of some of the best paper awards. So we'll go ahead and kick it off right away with our best technical and interdisciplinary paper presented by Ben Green. It's Disparate Interactions, an Algorithm in the Loop Analysis of Fairness in Risk Assessment.
All right. Hey, everyone. My name is Ben Green, and this is joint work with Yiling Chen. And the title of our paper and the talk is Disparate Interactions, an Algorithm in the Loop Analysis of Fairness in Risk Assessments. So as the title of the paper suggests, the context for this work is the increasing use of risk assessments across the criminal justice system. These algorithms are typically used in settings such as bail and sentencing to make predictions about people's future behavior. And the primary debate about these systems is whether or not the algorithms themselves are fair or biased. In response to high-profile reports about bias within these algorithms, machine learning researchers have engaged in a rapidly growing area of technical work to characterize fairness, the trade-offs between different metrics, and the limitations on how fair an algorithm can be. But despite this work often leaves out an essential component of how risk assessments actually create social outcomes in the criminal justice system, and this is their impact on judges. We often treat the risk assessments as autonomous agents, as the final arbiters, as if they are making decisions on their own, hence the focus on evaluating these systems based on whether they meet technical characteristics of fairness and accuracy. But of course, that's not how these systems actually operate. In most cases, risk assessments are presented to judges as advice and information, and it is those judges or other officers who must decide what to do with that information. And so given this context, what ultimately matters is not whether the algorithm itself meets characteristics of fairness and accuracy, but how they affect decision-making processes and the ultimate decisions that judges make. We cannot fully evaluate the impacts of these algorithms unless we also think about the social context that they are embedded in. So that's the key question we wanted to evaluate in this study. How do risk assessments actually influence human estimates of risk? We explored this question through experiments on Amazon Mechanical Turk. We began by acquiring data from the Department of Justice that contained several 100,000 records about criminal defendants and their cases and the decisions that were made about them. We used this data to create a pretrial risk assessment that resembles those used in practice along metrics such as fairness and accuracy. And we applied the risk assessment to a set of 500 defendants from the data who were from a held-out test set, and then presented the profiles and information about those defendants to workers on Mechanical Turk, asking them to make predictions about future risk, both with and without the advice of a risk assessment. Now, of course, the important caveat here is that these are experiments with Turk workers, not judges. So we can't necessarily say that the results are a one-to-one correspondence to exactly what's happening in the courtroom. But they do accord with some other empirical work, and they highlight the types of interactions between humans and algorithms that we need to be designing for and thinking about when we think about how to design these systems and evaluate them in real-world contexts. So the first thing we wanted to look at was participant performance, to think about how accurately people are actually making decisions. And we evaluated this we looked at 3 different groups. First is the control group, the people who were not shown the algorithm, the treatment group, the people who were shown the risk assessment, and finally the risk assessment itself, as if it were to have been making decisions on its own. And what we found was that while introducing the risk assessment improves human accuracy and improves the decisions that are made, the people who were shown the risk assessment still underperform the algorithm itself, suggesting that people are unable to effectively incorporate the algorithm's advice with their own judgment. And we also wanted to see if people were able to evaluate their performance. And we found somewhat disturbingly that they weren't. As people reported being more confident in their predictions, their accuracy went down. People were also unable to accurately evaluate the algorithm's performance. So we found that there were some significant breakdowns in the combination of how humans were interacting with the algorithm and trying to make predictions. And given this breakdown, we wanted to look at how different groups might be affected by the decisions that are ultimately made. What we found was evidence for what we call disparate interactions, which we can think of as disparate impacts that emerge through the interactions between the human and the algorithm as the algorithm's prediction is filtered through the person into a final decision. And we looked at this in two related ways. The first was thinking about the strength of the risk assessment's influence when it suggested to people that they increase the level of risk over what they otherwise likely would have predicted. And we found that when these suggestions were made, participants were far more likely to follow the algorithm, to weight the algorithm's advice more heavily when evaluating black defendants than white defendants. We also looked at how often people deviated from the algorithm, essentially overriding the algorithm's advice to estimate a higher level of risk than it suggested. And again, we found that participants were more likely to predict a higher level of risk than the algorithm when evaluating black defendants than white defendants. So what we're seeing here is that the interaction between the human and the algorithm is injecting a new form of bias into the types of decisions that are being made, which wouldn't appear if we were thinking about this system and evaluating it only in terms of its technical characteristics. And it may, on those terms, have appeared fair, even though the decisions themselves may not have ended up being so. And this is why it's so urgent that we consider the full social context when we think about how algorithms are being deployed. It's a lot more comfortable for computer scientists and honestly much simpler to just think about these as autonomous systems that we can evaluate for their technical characteristics alone. But when we do it from that perspective, the evaluations that we come up with are going to be severely underspecified. And what may appear to be fair in theory can lead to outcomes that are unfair in practice. So we need to think in a new way that can help contextualize the broader context of how algorithms are being used. Now, often when we talk about humans and algorithms making decisions together, we do it in terms of what's known as human-in-the-loop systems, where people are involved in the process of tuning and training algorithms to help correct for algorithmic blind spots and oversights. But this type of model is ultimately focused on producing the best possible algorithm. It's focused on creating an algorithm that can make the best decisions on its own to be ultimately deployed. That doesn't quite match up with risk assessments, where we are incorporating algorithms to help improve human decision-making processes. So I argue we need to think about these types of systems in a slightly different way, reversing this loop to think about algorithm-in-the-loop systems, where we recognize that we're incorporating algorithms into human decision-making processes and be orienting our focus not on the algorithm itself, but on how the algorithm affects the human decision-making process and the ultimate outcome that the person decides to choose. And this shift from technical evaluations to an algorithm-in-the-loop framework can help us ask the necessary and urgent questions about how to think about designing and evaluating risk assessments. This research can help inform, for example, pointing us towards the question of how introducing risk assessments might affect the deliberative process, perhaps changing a judge's sense of agency or responsibility in the decisions that are being made. Given that risk assessments are being incorporated into decisions that are directly deciding whether a human is put into a cage, we must be thinking deeply about the danger of moral buffers and automation bias. And ultimately, this research can inform the most important question of how risk assessments should be used at all. We must first ask, of course, whether risk assessments should be used in the first place. And this research can inform the debate about that, certainly by sort of informing and adding complexity to our discussion of objectivity, which is so often used to promote these systems in the first place, highlighting how there's always human discretion involved beneath the surface of seemingly technical tools. We cannot simply eliminate human judgment simply by introducing an algorithm. And if risk assessments are to be used, we must consider how they should be used, what types of interactions are actually desirable, and how to structure the algorithm to help promote those types of interactions. So these are incredibly important questions about risk assessment and other related algorithms that I fear we will overlook if we continue to treat these systems as algorithms in their own right. We may stumble blindly forward, often creating unintended and unjust social outcomes through the deployment of technical systems that we actually are convinced are fair because we haven't considered the whole picture. So we must begin by putting algorithms in the loop and considering the full socio-technical context to be able to help inform our ability to rigorously study and shape the social impacts of algorithms. Thank you.
Thanks, Ben. Next up, we've got Sendhil Mullainathan presenting our best non-archival submission, Dissecting Racial Bias in an Algorithm that Guides Health Decisions for 70 Million People. This is you.
Yeah, perfect. Thank you. All right. Thank you for having me. I just want to jump right in. I think machine learning is being applied in many, many parts of healthcare. For most of you, if you think of machine learning in healthcare, you probably think of a bunch of computer vision applications, early warning systems, diagnostics. These, I think, are good to put into the category of anticipating future deployment. What I think is less well known is in population health, where these are changes in how healthcare is delivered and making these changes in an attempt to cut costs and improve outcomes. In this area, actually, what many of you may not realize is algorithms have already been deployed at scale, and many such algorithms are operating today within the healthcare system. Let me give you an example of one such problem in population health. One thing we've learned over time is that as we try to think about how to cut costs in the US healthcare system, patients with chronic conditions are an epicenter of costs. So if you have diabetes, if you have high blood pressure, and in particular patients that have many such chronic conditions are really a cluster of costs. The healthcare system has looked at this problem and said, well, maybe one way we can try and reduce costs here is to improve the interface of these people who are interfacing a lot with the healthcare system. So you might show up at the hospital for one thing 1 month and another thing 3 months later, so you're there a lot. Maybe in the emergency room, maybe your primary care patient. So if we can change the front door, maybe things would change a lot. And so this has led to something that maybe many people in this room don't know about, but was a big change in healthcare in the United States. It's care coordination programs. Let me just give you a sense of how these feel in practice. Many hospitals, health insurers have started implementing them, almost all at this point. Here's how it feels. If you're in one of these programs, the first thing that you get is if you have a problem, you don't need to go to your doctor. You don't need to go to the emergency room. You call someone. You have a dedicated line for you, and that person says, hey, let me understand what your problem is. What this does is it triages. It gets actually some people to not come in because this problem is manageable. It's something you can deal with off the shelf. And it gets other people who might not have shown up to show up and say, actually, those symptoms sound pretty problematic. Come in, don't delay. It actually increases the communication with the system. Then when the person does show up, it's as if they've got a concierge service. They don't see the nurse that you or I might see. They see a registered nurse that's trained to handle these complex set of patients. And then when care is taking place, there's a person whose dedicated job is to talk to all of the people who are giving care for you and say, hey, let's coordinate the care, just to make sure everyone treating you is talking to each other. This is a high-touch thing. But because this is a person who touches the system a lot, it turns out that spending more money on them has proven to be very effective. It helps them. It facilitates access. It allows a lot of burdensome visits to them and to the system. It lowers healthcare costs, and in a lot of studies seems to increase health as well. So these programs benefit both insurers and patients. Doesn't need to be the case. A lot of programs in healthcare that lower costs also lower health. That's often how it works. But in this case, we have a happy situation. The unhappy part is they're expensive. So you've got to decide who gets access to them. Not everyone gets a dedicated line, a concierge, and a nurse. The industry-wide approach for solving this is to say, well, these programs are designed for patients with complex conditions. So what we're going to do is to try and predict next year's healthcare costs. Typically, for those of you who know, this uses claims data, typically to a lesser degree, electronic health record data. Don't worry if that doesn't mean anything, that's inside baseball. I don't even like baseball, I don't know why I said that. Once these algorithms are applied to the data, what happens is you're given a score, like a risk score that you're familiar with in many other cases. It's sort of how complex of a patient are you. This score is then used to determine who gets allocated to the program. In the algorithm we study, 97th percentile in this score means you're auto-enrolled. Around the 55th percentile means the doctor, as we saw in the previous talk, the doctor uses the algorithm in the loop, to use your terminology, to determine who should get in there. But the risk score plays a pretty big part there. We can see that in our data. Today, what I want to do is to analyze a live scaled algorithm for bias. It's kind of an interesting data set because the healthcare provider that we work with has been purchasing the algorithm. We know the algorithm score, but because we have all the data on the patients, we know everything about the patients as well. So we can see the algorithm, so on. What did we find? We first wanted to understand what was the extent of racial bias in this algorithm. As we've seen many days today, there are many different measures of bias. Our interest is, of course, not the score, but the consequence for who gets the program. So as a result, I'm going to focus on calibration. For those of you who are not familiar with the numerous terms here, I'm going to do something very simple. I'm just going to say, at a given level of score, what is the outcome for black patients and what is the outcome for white patients? So it's fairly simple. And if we're going to use a fixed threshold for both groups, that means we're going to get different types of populations in there if there's a gap. All comparisons are on the holdout set by design, and everything is in the future. We can come back to this. It's about 45,000 patients. 12% of our data is black. So I'm going to walk you through a set of figures that are going to look very similar. This is a set of chronic medical conditions that we have measured in our patients. And I'm going to start with the most obvious. How many chronic illnesses do you have? And I'm simply going to put on the x-axis the score they were given, and on the y-axis I'm going to put the number of chronic illnesses, and I'm going to do this for blacks and whites. And what you see is a pretty large gap, that at the same level of score, blacks are much sicker. One way to understand the magnitude of this gap is to sort of zoom in. 28% more chronic illnesses at this auto-enrollment threshold. If you said, I want African Americans and whites to be of a similar health composition, if we want to simulate, what we would do is replace less healthy African Americans who didn't get in the program with the healthier whites who did, keeping the number constant, just to understand how big of an effect this would be. So if I zoom in here, I would basically add these and remove these and equalize. If I were to do that, the fraction at auto-enrolled blacks would go from 17.7% to about 36%, a doubling of African Americans in the program. So this gap is not a small gap, it's a large, large gap. I'm not going to bore you with this. You can do this for many things. You can look at higher blood pressure, huge gap on higher blood pressure. You can look at diabetes. The blacks who are left out of the program have significantly worse diabetes than the whites who are enrolled in the program. Lung function, anemia, kidney function. So that's by way of saying, if you're interested, we can go through that. But I want to get to what went wrong. What went wrong is a clue in it is in thinking of what the algorithm is getting right. It's at every score level, we saw these health disparities. But you know what we don't see a disparity in is costs. The algorithm is extremely well calibrated by race for costs. It's kind of interesting. So what's happening? The problem is black and whites do not have the same relationship between health status and costs as you can imagine. Whites have better access to healthcare. So when you look at this, you see at every level of health, African Americans cost less. They see their primary care physicians less. They do a lot less access. About 30% less costs. The better the algorithm predicts the variable it was asked to predict, the more bias it is taking on. So the problem is not in the innards of the algorithm. It's in the label that it was given. It's a cousin of mismeasurement, cost itself is not mismeasured. It's measured reasonably well, perfectly well. It's in the objective we've given the algorithm. So the deeper cause, and this is what I want to end on, is, well, so why did we give costs as the objective? I want to dissect the problem. One, as with all things, follow the money. We gave costs because, well, hospitals and insurers care about costs. They care about the dollars. In fact, for those of you who follow healthcare policy, generally speaking, most of the problems in healthcare policy we have are because insurers care about costs and we as society care about health. This is a prediction version of what we see in the rest of healthcare. Great. Let me put a second possibility, learning. Even in policy conversations, we kind of conveniently talk about costs, talk about health, they end up being the same. So the cost label was chosen through convenience and not understanding consequences. The differences between these views matter, as you can imagine. And so this is where we were, and this is going to be the end of the paper, except I have one epilogue. After we wrote this paper and submitted it, actually, we thought, why not contact the manufacturer? This will be interesting. What will they say? They were super responsive. They said, hey, we want to work with you guys to understand the problem and to try to fix it. So we collaborated with them. Unlike our data, which is about 50,000, they've got 3.7 million data sets. And now they're developing a method to adjust the bias. And there's about substantial reduction in bias in this method. We've basically gotten 84% of they've gotten 84% of the bias out of the system. They're looking to get the last 16%. So just to summarize, for me, I kind of walked away optimistic. I was like despondent, and I'm like, wow, the manufacturer is actually kind of quite eager to fix this. So thank you.
Thanks for ending on that hopeful note, Sendhil. Next up is Stevie, Chancellor, presenting a taxonomy of ethical tensions in inferring mental health states from social media.
Hi, everyone. Connected to our last talk about healthcare, today I'm going to talk to you about a bunch of interesting ethical issues that emerge when we start applying machine learning and AI to a sensitive issue like predicting mental health. So on behalf of my co-authors, Michael, Eric, and Vince are actually clinical collaborators, and Munmun, I'm going to talk to you about the entire process of building systems like the ones that I work on typically. But let's start with an example that's actually been going around in the media. So in mid-2018, Facebook AI started implementing a system behind the scenes to be able to detect if someone might be suicidal on their platform. This uses behavioral cues from someone's engagement on the platform, including posting to Facebook Live, engagement with friends, and linguistic analysis to understand if someone might be considering taking their own life. And according to NPR, 10 or so people are picked up by the system every single day who might be considering harming themselves or ending their life. Now, Facebook isn't the first research organization to come up with the idea of using trace data from social media to be able to predict mental health status. And in fact, this is my primary area of research. In about 2013, we've seen a new area of work emerge that combines insights from machine learning, natural language processing, and human-computer interaction research to be able to predict mental health status or mental disorders and their symptomatology from social media. And we have some really powerful algorithms that now can predict lots of mental health conditions, from mental health conditions like depression, the risk of committing suicide, to schizophrenia, but also symptomatology that might indicate early on that somebody might end up later having or suffering from depression. And you can imagine that these systems can be very powerful in being able to detect symptoms that someone might not even recognize or know that they need to go to a clinical care provider to receive treatment. Importantly, mental illness is very stigmatized and is highly underdiagnosed because people don't reach out or have access to treatment. And these algorithms, in some ways, have been sold as an amazing opportunity to provide monitoring, intervention, or crisis efforts to be able to understand and interact and intervene when mental health issues arise. But one of the challenges, like I mentioned earlier, is that this area is highly interdisciplinary. We're taking insights from machine learning, AI, natural language processing, and human-computer interaction, not to mention work with clinical collaborators whose specialty is in psychiatry and psychology, to be able to predict these kinds of algorithms or these kinds of status that we see on social media data. These fields all contribute essential pieces to this puzzle, yet there are fundamentally no standards on how to conduct this research. And when I say standards, I mean, how do you include people within your data sets? How do you make predictions on mental health? What are appropriate features to engineer in this space? And what are appropriate implementation systems of algorithms that can predict mental health status? And so I talked to you about some of the amazing implications for being able to detect and treat mental illness early, but this also comes with a lot of risks. Not only from building bad or erroneous machine learning models and doing bad science, but also improper causal assumptions and incorrect diagnosis, which might therefore influence diagnostic patterns within digital psychiatry. But there's also the issue of unaccountable or bad actors who might use this algorithm to somehow discriminate or harm people who suffer from highly stigmatized and in some places illegal mental health conditions where they might be arrested or somehow harmed for suffering from a mental health disorder. And the risks, I think, are incredibly substantial given that we're working on such a sensitive issue. So what we do is we actually just develop a taxonomy of these unresolved ethical or tensions in algorithmic predictions of mental health status using social media data. And this is one of the first comprehensive taxonomies that identifies these challenges in an applied domain of ML or AI. And importantly, because we participate in and can analyze this research, we start from the beginning all the way to the end of the potential implications. And so we're able to pull out to unresolved tensions that are both about the methods as well as the recruitment, all the way to the implications of this work. And our goal is to make these tensions explicit and ask lots of important questions with the hope that the community of folks working in this space across a really interdisciplinary group of excited researchers, clinicians, social networks can start to answer these questions more effectively in their work and in the implementations of these algorithms. So we organize our taxonomy into 3 high-level areas, which have about 15 areas of concern and lots more questions underneath. I highly encourage you to read the paper to get insights into these areas because unfortunately, I don't have enough time to talk to you about all of them. I am, however, going to walk you through one of these, which is validity, interpretability, and methods, a common thread across FAT because many of us are interested in AI and mental health. In this case, I'm going to talk to you briefly about algorithmic interpretability and the importance for stakeholders in the space to be able to understand or perhaps use these algorithms in more nimble ways to be able to understand mental health status. So broadly and simply put, interpretable algorithms help us understand the outputs, as well as the decision-making processes that algorithms take. Typically, this is done in linear and logistic regressions and decision trees. Now, on the other side of the performance that we can see is deep neural networks, right? State of the art in handling multimodal data really elegantly and really boosting performance in this areas. And in the state of the art in this field, we see those kinds of gaps emerge. People using deep neural networks are outperforming dramatically people who use linear and logistic regressions. But there's obviously a trade-off when dealing with clinicians or other stakeholders who are involved in these decision-making processes around mental health and using social media data to understand these behaviors. So let's walk through an example. This person is suffering from crisis, and Facebook or another algorithmic system detects that they might be considering taking their own life. How interpretable does this algorithm need to be able to decide if we should intervene? Now, we could err on the side of very, very interpretable, but the risk is that we make errors. And those errors can be incredibly dramatic for people who are suffering from mental health, but even more risky is the risk of false negatives when we miss people and misappropriate responsibility for who needs to have an intervention deployed now. But even an interpretable algorithm that can help us understand when to make these decisions might not actually be quick or call into account who needs to intervene down the line. The example of the crisis counselor, their decision based on the interpretability of the algorithm impacts downstream actors from care teams, police forces who might be deployed, whether or not this person should be committed to a psychiatric hospital. Importantly, this doesn't even ask if this person wants to be predicted on, or if their data was authorized to even be in our pool in the first place. And I think that crisis is a really elegant example of the problems of interpretability, but there's other issues with interpretability as well. Whereas we build monitoring systems to be able to detect symptoms or automated interventions. Perhaps we would prefer higher accuracy or better metrics when dealing with automation, But that takes away agency from those who are involved in the predictions, as well as key stakeholders in being able to understand mental health. And fundamentally, the community just doesn't have answers on how to resolve these questions. And as groups like Facebook or clinical collaborators or even researchers begin to implement intervention systems or monitoring systems, these must be answered, because we might be making mistakes, errors that have dramatic downstream harms on people involved in these prediction systems. Now, as I mentioned, there are sort of 15 or so broad areas and lots of questions that our paper unpacks. And I've shown you one example that we provide in the paper. And so I want to actually think about how we start to solve these questions, rather than just ending on the note and saying, there's lots of problems, let's all solve them together. So I think one of the potential solutions to this problem is by bringing key stakeholders into the process from the start. As I mentioned, we work with clinical collaborators who actually work to help us interpret the understandings from digital psychiatry and apply them to ML and AI techniques. They also help us interpret the algorithmic output to make sure that these algorithms help us understand people's behaviors correctly and aren't just throwing red herrings that might just be pulled from a specific data set. But in addition to stakeholders like clinicians and social networks and other involved parties, I think inherently we have to have participatory approaches of people who these algorithms would be predicting on, involved in how we can use these algorithms to understand people's well-being. Without their input, we won't be able to understand how these algorithms can impact their well-being, their engagement with care, and ultimately if we can use this to improve mental health within our lives. But I also think that there's an important standardization that needs to happen. A lot of these papers are submitted to venues as diverse as CHI, ICML, AAAI, and reviewers oftentimes have inconsistent standards for the review of whether or not the algorithm actually works. And so I think standardizing best practices for methods and evaluations is an important step in being able to make sure that we have a practice around being able to predict something like mental health. Finally, I think that there's a solution in being able to design beyond what a traditional ethics board asks us to consider. So rather than considering issues that an IRB, a Federalized Assurance Board, or another sort of ethics board asks us to consider, we need to start thinking about new kinds of risks that these algorithms can have and design risk management protocols for the kinds of issues that we see when dealing with mental health. What do we do when we see somebody, for instance, in a social media data set to be able to predict these kinds of behaviors? And so I'd like to encourage you to read the paper. Here's the title again so you can take a quick photo. Thank you so much. I appreciate your attention.
Okay, and finally, we've got Severin Engelmann to present Clear Sanctions, Vague Rewards, how China's social credit system defines good and bad behavior.
Thank you. Okay. Yeah, so good afternoon, everybody. I'm Severin. I'm thrilled to be here to present our empirical work on the Chinese social credit system, work conducted primarily with Chen, Jens Grossklags, and Felix Fischer. Now imagine what it would be like to live in a society that rated citizens' behaviors through a digital socio-technical system. Look at this family, for example. Because Confucius conceptualizes the family as one moral unit, the father's behavior will affect the children's ratings. So what are we talking about here, actually? You've all probably heard quite a lot about the Chinese social credit system, but what is important is that it's currently under construction. We know that it is developed at local, regional, and national level, and we know that all legal entities, so individuals, companies, and other social organizations, are expected to receive a unified social credit code that serves to connect behaviors to public shaming and praising lists. So being on such lists, either praising, which is the red list, or blaming, which is the bad list, can either lead to being rewarded multiple material rewards, or can lead to the exclusion from such material rewards or goods. Currently, there are at least two main reasons why the social credit system is implemented in China. One reason is that only Chinese citizens declared moral decline as one of the major issues in their society, as a survey by Ipsos showed in 2017. And secondly, the SES is motivated by economic factors. China has the largest unbanked population in the world, which means people without a bank account. And through the SES, loans can be given based on their trustworthiness rather than their financial worthiness. So let's go back to this family here. In such a system, what kind of information, under such transformative conditions, what information would you need to know about the system? Well, you would need to know the information relevant to understand what makes for good moral behavior and what makes for bad moral behavior. And this is actually a fundamental philosophical question. So philosophers have come up with two necessary and sufficient conditions to assign moral responsibility to an actor. One is the freedom condition, which denotes that an actor is morally responsible when he or she was not coerced or forced into performing a certain activity. And then secondly, the epistemic condition, which is important for this work, which denotes that an actor requires certain informational resources in order to be aware of the moral code of conduct, in order to be assigned moral responsibility. So henceforth, we wanted to understand the current epistemic conditions implemented by the SES at the moment, which translated into the following research question. How transparent is the current Chinese social credit system in providing information on good and bad behaviors? And we identified at least two epistemic conditions in the current implementations, which led us to perform two different empirical studies. In the first study, we analyzed close to 1,000 character portraits of positive and negative model citizens. And in a second study, we analyzed more than 150,000 blacklist and redlist records from the Beijing SES information platform. So let's turn to study one. Since September 2017, the national SES platform creditchina.gov has published stories on positive and negative role models in Chinese society. And through this, our content analysis, we revealed that all of these stories embed moral standards on how to behave in specific situations that bear moral significance. So what we found was that stories on positive moral characters always included a virtue cascade. So once the actor had performed an honest behavior, such as returning the found property of another individual, he or she is assigned other virtues, such as being helpful or not being corrupted by money. And sometimes they terminated in a positive social norm message, such as, he's a really good doctor in our village. On the other hand, in the negative narratives, we found one prominent theme, namely the Lao-Lai stereotype, a common stereotype in Chinese society. A Lao-Lai is a person that typically has debt, lies about having debt, and then tries to escape his or her debt obligation. And these stories most often terminated with a social exclusion message. So overall, we can say that because these stories were highly homogeneous in structure and content, we believe that they have been deliberately engineered to inform the public about desirable moral behavior in the SES. However, only stories on negative role models include specific SES-relevant information, such as the threat of being publicly shamed or being put on the blacklist, whereas positive character stories did not include such information. In a second study, we analyzed a large amount of different blacklist and redlist entries from the Beijing information platform. So what is important to realize is that there are currently multiple blacklists, but we only found one redlist. So if you would like to have a more comprehensive view over the different blacklists, then please take a look at our paper. We found that currently all blacklists and redlists can be queried. So you can simply type in the name of an individual or a company or the Unified Social Credit Code and see what kind of data is available on that entity. We furthermore found that there is a one-for-all template, so different blacklist and redlist entries are kept on one template for one single entity, which is indicated by the asterisk. And as you can see at the top right corner, the hashtag indicates a contest decision functionality, so individuals can already contest decisions made by the system about them. When we analyzed the redlist entries, we found that they all provided honorary titles. So here, for example, as the hashtag indicates, here's an individual that has performed a certain amount of voluntary hours and is henceforth given the honorary title 5-star volunteer. Currently, there are more companies on the red list than individuals, and companies mostly received A-class taxpayer honorary rewards and other different types of rewards. When we turn to so very important, for none of the red list entries that we analyzed, there is any justification or explanation given on why this entity has received this honorary title. When we turn to the blacklist of companies, we found that the most common reason for being on the blacklist, as you can see on the y-axis, is failing to fulfill debt obligation. The second one is violating property reporting systems, and the third most common reason is trying to evade enforcement. And this rings a bell because those are the 3 hallmarks of a Lao-Lai stereotype. So the Lao-Lai stereotype that we found in study 1 extended into the blacklist schemes that we analyzed in study 2. We found another blacklist that was issued on the Civil Aviation Administration, which listed people that are banned from flying. So these lists contained the name of these individuals, the shaded ID number, and quite extensively provided reasons as to why these people had been listed. And notice here on the left, these 2 asterisks indicate non-Chinese citizens. So here we can provide some evidence that non-Chinese people are also included in some capacity in the current implementation of the social credit system. Okay, so this was the first empirical study on the Chinese SES, and what we can say is that there is currently no unified social credit score. We can say that there are more companies listed on both red list and blacklist than individuals. And we can say that taking study 1 and study 2 together, information on bad behavior is more rich than information on good behavior. So blacklists, for instance, include a direct connection between behavior and sanction, whereas information on good behavior did not have this kind of connection. Okay, so I want to end this talk with a hypothetical situation. So imagine a hypothetical scenario of full transparency in the SES, meaning that specific compliances and non-compliances are mapped to discrete changes in score. So if the SES became fully transparent in regard to its scoring mechanism, complying to a norm would likely become a market transaction. So this could result in individuals refraining from attributing a genuine moral character to individuals with high scores under such transparency conditions. So this suggests that different degrees of transparency could correspond to different behavioral engineering goals in China's digital socio-technical system. Thank you very much.
We're going to do some rapid fire questions because we just have a few minutes. Go ahead.
Hi, I'm Jenna Burrell from UC Berkeley. My question is for the first talk for Ben. I completely agree with the need to kind of push beyond kind of looking at algorithms in isolation and to consider their social context. The question I'm going to ask, which I'm sure there are other people in the audience who would want to ask this, is what makes you think that anything you would find about Amazon Mechanical Turkers and how they make decisions about a risk assessment would translate to judges, given the professional training and expertise and deep, like decades-long experience judges have?
Yeah, that's a great question, one that we obviously grappled with quite a bit in thinking about how to do this. I'll just, to sort of a brief answer in addition to some of the discussion of it that's in the paper, is that there is some of the empirical work on this that's looking at judges making decisions with risk assessments in context that does actually match up with our work in terms of being much more likely to deviate in punitive directions and seeing some places where they've found sort of thresholding where judges are more likely to be more punitive for black defendants than white defendants. So, but again, we view it more as sort of trying to inform the types of things we should look at and inform our understanding of what might be going on behind the scenes of those empirical studies. Certainly it's not a perfect match on what's going on. There's a lot of other contexts that we're not incorporating.
Hi there, my name is Laura Bacon. I work at Luminate, which is part of the Omidyar group. And I had a question around the biased algorithms related to chronic health issues. So one of the chronic health issues that was listed, I noticed, was cancer. And I was diagnosed with stage 3 breast cancer 2 years ago. I'm still being treated for it. And in this process, I have been learning a lot about healthcare disparities and about racial bias with respect to cancer. And one of these is that although white women have much higher rates of incidence of breast cancer, black women have much, much higher mortality rates. The death rates are 40% higher for black women with breast cancer than white women. And most of this is because of when it's caught. It needs to be caught early before it becomes chronic. And it has to do with early screening and lots of other disparities that we know exist. And so it seems to me if the goal is to save lives and save costs, and I know this is more of a policy question than an algorithm question, wouldn't it in fact be better to catch this early and set up algorithms that supported black women to get screened earlier so prevention happens so it wouldn't become a chronic disorder? Thank you.
Yeah, I agree with you 100%. That is, I totally, completely agree. And I think that if I were to add to it, I would say that I think in the population health world, one of the things people are trying to do is to, in fact, try to figure out how do you target screening interventions, try to get it in there earlier. But I don't think these things are mechanically just going to work out to improve things, and I think getting into those type of areas would be super beneficial as well. So point taken.
So let's do 2 more questions, and I would ask that if there are folks who haven't had a chance to ask questions, maybe we can prioritize those folks. Go ahead.
Hi, I also have a question for Professor Mullainathan. I'm Sid Basu, I work at Airbnb, and my question is very basic. I'd love to hear more about the steps you took to debias the algorithm and how you achieved kind of like 80% reduction in the bias.
Yeah, I think Solon, for example, has done this work on, I think the most useful thing in this activity is to get to the heart of the label and how the label might be differing from the thing we think the label is doing. I think in Solon's work, it comes out in the qualitative data, and the work we've done with firms and governments, it comes out is the conversation on what is the objective and the conversation on what is the exact label often kind of mushes together, happens really fast, and people don't realize algorithms are super literal, and that even if the label is pretty correlated with the concept, in that wedge, lots of bias can creep in. And so if you imagine your time chart of how much time did you spend building the algorithm versus how much time did you spend asking, is this the right label? Where could everything go wrong? I think you'll find that it's disproportionate, and that if we can even work towards making those match up more, that would be super valuable.
Okay, let's take one more. Go ahead.
I had a question for Ben about, I really appreciated kind of seeing the whole algorithm in the loop versus human in the loop. I was curious as to what your thoughts were in terms of like the legal repercussions of that reframing. So as an example, right now there's a conversation happening in terms of legalizing lethal autonomous weapons, and there's like a bunch of philosophers talking about how like human control is the thing that should be regulated. So there should be a mandate on how involved humans are in the deployment and design of the goals of these systems, and that's what should be regulated. But there's also kind of another fraction of people saying there should be no lethal autonomous weapons, and the algorithm should be, sorry, I'm short, the algorithm should be regulated, and yeah, so like I was curious as to what you thought the legal repercussions of that reframing would be, and if you guys did any kind of thinking about that.
Yeah, that's a great question. There's a lot that could be said there. I think that we didn't sort of go deep specifically into sort of tying into the legal aspects of it, but I think that, one of the challenges that we see is actually trying to articulate how we want these systems to be used in practice. There's, I think we sort of, on the one hand, would feel uncomfortable with algorithms just making decisions by themselves. That's a bad idea for a lot of reasons. And we might want to say, okay, clearly there might be benefits to introducing the algorithms. Where in the middle do we want to be? And actually, if you look at something like the Loomis case, I feel that they sort of contradict themselves internally, saying this information should be used because it can provide more information. And then they say, here are all the things it shouldn't be used to actually affect, though. It can't affect whether or not you're sentenced. And there's not a clear way of determining how it actually will only have those impacts, and to ensure that it only has those impacts, both in terms of structuring the interaction and holding that interaction accountable. So I think in sort of both legal and moral terms, there's actually a huge open area that we haven't really defined, and I think that is what leads to a lot of the issues with how these systems are designed in the first place. Thanks.
Thanks so much to all of our panelists.
Thanks for your time.